GP corporate giant Primary Healthcare has officially changed its name to Healius as part of a brand overhaul. Today I'm talking to Healius CEO Dr. Malcolm Parmenter about the reasons behind the new direction and what the future holds for the business. Malcolm Parmenter, welcome. Why the name change after 30 years of operating under the Primary Healthcare banner? Is this a concerted effort to shed the past?
Look, we've been on a journey to a new place for probably 3 or 4 years now. Now, I've only been here for about 14, 15 months of that, but we've been looking to change a lot of things about who we are as a company, and we did things one way in the past, and we have a very different view of where we move to in the future. We had a reputation for being in the courts a bit in the past. We've changed our contracts, we've taken the restraints out, we don't beat a path to courts anymore. The name change came well into the process of change. We're not thinking that a change of name would necessarily drive a new culture, but it's a signal that we have changed.
Over the last couple of years, you've recruited a lot of GPs, but you also saw almost as many leave the business. Can you explain how and why this has happened?
You know, in any group, there is a small percentage that aren't really working with the way the practice works. And this has been a process of getting us to the standards that we want to operate in. And so, I guess the other part of it is that we are in a process of change. So we've been rolling out appointments and new systems and processes and things like that. And that's been something that's been coming for a while. And you can't do it all overnight, but we're a long way through that process now. But in the early phase, I think there were doctors who've been waiting a long time for change in this company. And so it's arriving now, but for some of them it didn't arrive quite fast enough, I guess, is probably the reality of where that is.
You have 75 medical centres. You have a 1,000 strong GP workforce with plans to increase that number by about 45% within the next 3 years. That's quite an ambitious strategy. How are you going to entice GPs to join the business?
It's a much better product now than we had before. We're competitive in the marketplace on what we offer in terms of commercial terms. We have a great working environment. We have well-supported centres with the best of technology coming online. I think it's a good place to work.
So what you're talking about is the complete overhaul of the medical centres model. Is that right?
Our medical centres have changed a lot. So we now see the GP very much as our customer. We're the service provider to them. And so very much it's focused around, so what makes the life of a GP and the work life of a GP better in that scenario? And so that's around encouraging continuity of care. We didn't used to do that. So the old model of patients walking in and see the next available GP tended to encourage patients to see a different GP each time. Now, in reality, many of our GPs worked around that anyway and told their patients to come and sit outside their door and they'd look out for them. Continuity of care did happen, but the system didn't really encourage it. We now have appointments, which not only allows continuity of care, but becomes a better experience for patients.
That's a big change for the business, because primary was always seen as the giant bulk billing centres. So now Healius is coming in, you'll be a mixed billing operation.
It is quite a change, and so we've got quite a significant team that we call our leapfrog team that are leapfrogging medical centres one after the other. So that process now is through close to 40 medical centres that have gone through that process. And so we expect to have that process completed by about August this year. So it's going quite quickly in terms of the changes, and that's around a whole lot of systems and processes, technology, appointments, and then there's a property component that's coming behind that. Obviously you can't go quite that quickly with property change, but with quite a significant refresh of our medical centres in terms of their look and feel, but also their layout, because we had a particular approach to it in the past, and this new approach means that larger treatment rooms, different kind of reception area, a few other changes around how this works that make it work more efficiently and create better support for the doctors that work there.
Malcolm Parmenter, thanks for your time.